If we're really weak in our abdomen, we can't find these muscles very well, we don't know how to work them or squeeze them, a lot of times that pelvic floor is gonna not work the best either. Again, remember this is like our soda can, so top of the can, bottom of the can, all the sides of the can. So things don't work well here, they're not gonna work well down there. So I want everyone, you can do this sitting, everyone put their fingers on their little bony parts right here, little pelvis bones right there. It's called your ASIS, it's in front of your pelvis. Good. Walk your fingers in a little bit on the inside of that pelvis. So this is where some of our deep core muscles lie. Transverse abdominis and some obliques are right here. And we're going to work on squeezing it. So we're going to inhale, do that diaphragm breath I taught you. Inhale with your rib cage. Exhale, I want you to feel those muscles tightening under your fingers, thinking about zipping up from your pubic bone up to your rib cage here. Okay. Let's inhale again, soften your belly. So I'm going to see, you can see my belly. Inhale, exhale, and inhale again, and exhale. Good. Did anyone feel any tightening? Yeah? Good. Did anyone feel nothing? Some, maybe, don't admit it. Some people are always like, I feel nothing. What's wrong with me? So we definitely want these ab muscles to work in conjunction with our pelvic floor, but I always like to teach abdominal wall contraction first before we dive into the pelvic floor too. Let's do our bladder leakage test. Participate if you'd like. Let me actually, I'm sorry, I'm gonna go grab my little guy because I forgot to put it up here. I don't want to miss something. Okay, so the first one, everyone stand up if you want to do this. Do it at your own discretion. Okay, this is my leakage with exercise scorecard that I made up. So we are going to start with jumping 20 times with our legs together. Okay, let's start easier. We're going to bounce 20 times with our heels. 1, 2, 3, 4, 5, 6, 7, 8, 10, 11, 12, 15, 16, 17, 18, 19, 20. Did anyone feel like maybe a drop came out or it felt really heavy? Anything like that? If you felt that, go ahead and sit down. So now, the next part is we're going to 20 times. 1, 2, 3, 4, 5, 6, 8, 9, 10, 11, 12, 15, 16, 17, 18, 19, 20. If you felt like heaviness or leakage or pressure, go ahead and sit down. Yeah, so we have some issues with some jumping. Okay, so now let's do 20 jumping jacks. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. If you leaked a little bit, sit down. You had pressure. And then in my clinic, I have an actual little trampoline I make people jump on, so that's the next one. Can we do single leg hops 20 times? Okay, so let's do the right leg first. Yeah, I know we're in cute outfits, so take your shoes off. Or 1, 2, 3, 4, 6, 7, 8, 9, 11, 12, 15, 16, 17, 18, 19, 20. Okay, you felt like you're going to pee, sit down. Let's do 20 on the other side. 1, 2, 3, 4, 6, 7, 8, 9, 10, 12, 13, 14, 15, 17, 18, 19, 20. Good job. Sit down if you feel uncomfortable. The last two. The next one is coughing. Big coughing 5 times. So, we're going to do, cover your mouth, do 5 coughs. 2, 3, 4, 5. If you felt like you couldn't pee or felt heaviness, sit down. Last one is sneezing, so 5 sneezes. You can do like a 1, 2, 3, 4, 5. Yay! If you passed them all, good job! So a lot of times, yeah, the jumping people are hard pass. And so, but you know, to be fit and active, maybe you're not doing a ton of jumping regularly as your mode of workout or running, but still, we need to get out of the way of things. We need to move our bodies in those ways, so it's really important to be confident in those movements and not feel like you're gonna pee your pants. Good job, guys. Trying to dispel some myths for you guys. Don't you need to go to pelvic floor therapy if I didn't have a kid? And what do you guys think? Yes! You can have pain with intercourse and not have a child. You can have bladder leakage and never have had a child. So it's not just reserved for people with that have had biological children. You can absolutely see a pelvic floor physical therapist if you did not have a child. So I believe that's a big question that you get sometimes in these groups. And I want to make sure you know it's for everybody who has that pelvis. Should I just do Kegels? Who was told by their doctor, just do a bunch of Kegels and be fine? Yeah. And that's like not to diss on doctors, it's just like, this is my specialty and I really know how the body moves. And maybe that's something that they learned that really allows that pelvic floor to contract and relax. But with a lot of these issues we're talking about, it's an issue of the pelvic floor being too tight and too weak. So if I'm just sitting over here and doing my Kegels in the car, I'm over-tightening an already tight muscle. Do you think that's going to make sex feel good? Not really. So we need to make sure we have length before it's straight. So we need to kind of do this properly. Yep, we don't want to already tighten a muscle that has too much tension through it. Kegels are not for everyone. You know, sometimes I am teaching them though because I have good length in the person and they're moving well, but they just don't have good coordination. So a lot of times I'm working on training that pelvic floor with the abs and the inner thighs together to help create a good contraction. Another fun thing about the pelvic floor is it should respond to load like a trampoline. So when we're just jumping and bouncing, our pelvic floor is like a little trampoline in our body. So it's absorbing the load and then recoiling. If we don't have good ability for us to load that muscle, like Brittany was talking about load and capacity, it's not going to be able to keep you in control of your urine, maybe your bowels, maybe it feels really heavy and painful. However, okay, so let's still learn how to do one because quite often I love teaching a little quick pelvic floor contraction if you're struggling with like you're leaking with sneezing and coughing, okay? So one of the best cues I have found that help with the pelvic floor contraction is imagining the muscles more around like your anus and butt, okay? So a lot of times we're always trying to think about squeezing my vagina, squeezing my, sucking up through a straw in my vaginal canal. We did research on this, and the best cue for the pelvic floor is imagine you're picking up something with your butt. Imagine you're picking up a blueberry or a marble with your butthole, with your anus, okay? So, I want everyone, if you're comfortable, to sit on your hand, put your fingers right on the inside of your sit bones to feel your pelvic floor there, okay? So, let's inhale with our diaphragm. And can we exhale and think about squeezing and lifting up with our penis? Let's inhale and drop it. And let's exhale and squeeze and lift. If you don't feel anything, you should probably tell me. If it feels really tight in there, like it hurts to sit on your hand, your fingers feel like they're hitting a wall, maybe your pelvic floor is a little tight, maybe you should do this. So we truly figure that out. Pelvic floor physical therapy. Is your pelvic floor tight? Is it weak? Is it tight and weak? Which muscles are tight? And we'll make that plan when you come in. Right, so those are little quick, let me finish what I was going to say. So once you know how to engage your pelvic floor, let's try to do that pickup blueberry squeeze with a sneeze. So let's like cover our mouths or pretend cough and go. See if you can pick it up, and on the inhale, let it go. Exhale, pick it up. Inhale, let it go. Exhale, pick it up. Some people feel lost. Like, what am I doing? Some people are just laughing. So this is all stuff we figure out in person. Yeah. I will say only like maybe 20% of people actually do a Kegel right when I ask them. I usually just say, well, let's do a pelvic floor squeeze. What do you think that is? And I get all sorts of stuff. These are some people that have like come to see us, just had some great results. I just want to normalize like getting help with this because I feel like people don't, and it's just so important that we take care of ourselves. We've been told that this is something that we just live with. So these are some of the people we've seen recently for diastasis recti, for postpartum recovery, and this is another PT we were treating who doesn't do pelvic floor, but so we actually see a lot of other rehab professionals because that's pelvic floor is our specialty. All right. That's a QR code for Instagram if you guys are Instagram people. If you don't have Instagram, just take a photo of this little slide. There's our website down here. We have a lot of good free information on our website. We have some free guides. We have some workshops coming up. I'm actually doing a menopause workshop on Wednesday with some other providers in the area. I'm going to be talking about these similar issues. Some physicians are coming to talk about how they approach weight loss and other medications. Yes, are there any questions? One thing really quickly too, again, I know this is something that some people feel really embarrassed about and they don't want to get help with. We do offer free phone consultations, so you can talk to a member of my staff on the phone, talk about what you're going through, and seeing if this is something you would want to do. We do free in-person consultations right now. We just added it back in. It's a 30-minute visit with one of my physical therapists who has pelvic floor certification, and we're talking about just, it's a little bit more just talking about what's going on with you and seeing if this would be a good fit. And then this is my last week. The last 2 weeks of August I've been doing 20% off evals for back to school, so we're offering that as well. But I'm here now for questions.
Yes, if you have questions, I'll run by to you or
Okay, I can just repeat it too. Yes?
what is a hernia?
Yes, a hernia is a situation where we have maybe an opening in a tissue. So a lot of times they're in the belly button or umbilicus area. They might be an inguinal, an area where there's been a little separation of tissue there. And we go to have that pressure in the body, jumping, coughing, sneezing. We're doing ab work, and we're seeing a bulge of that tissue. It's a loss of pressure, usually due to an injury. Sometimes people have hernias they were born with or they've had a long time, and we work through that. And some postpartum people need surgical repairs too. Sometimes with belly button hernias, and they just have issues with strength and recovery of that too. So they can work with PT and or surgery depending on how bad they are. What other pelvic floor questions do you have? Caitlin?
So pelvic floor work can be, intimate, as you were just kind of speaking to. Is it always internal work that has to be done? And any advice that you would give to somebody, I know you do the free consultations, but any advice you would give to somebody who is a little nervous about that?
Absolutely. So one of the really remarkable things we can do as pelvic floor physical therapists is to examine and evaluate the pelvic floor internally. So what that looks like is using a gloved and lubricated finger and examining the muscles from the inside. So that's going in the vaginal canal and basically feeling for tightness, tone, pain points, and strength. We do this vaginally. We also do this rectally as well for people with bowel issues. But that absolutely does not have to be a part of your treatment once we get started. We just started treating another woman recently who unfortunately has gone through some very severe sexual trauma, and that was one of the requirements firm. She's like, I will come in, but I absolutely don't want any internal work. I'm just not comfortable with it yet. Just, that's where I'm at. And we said, great, we can do a lot of things externally and not have to put our fingers anywhere, and for you to feel like you're getting help really. So, great question. It doesn't always have to be, but a lot of times it is, and people are like, wow, I had no idea, like, and I can see results pretty quickly when we do internal work, so just keep that in mind. Do you have a question too?
Well, when you come back to Fit Body, I just started the gym and missed your session. So.
Sure. Do something. Yeah. That'll be fun. Let's do it. Yeah. We are out of network practice, so a lot of pelvic floor physical therapists, because this work requires a little bit longer of a session than the insurance company will reimburse us for, we have kind of been forced to go out of network. So that's how our clinic operates, but a lot of people are like, you know what? This was amazing, and I want to get help with this. It's an investment, and this is a massive amount of value to me. So, yeah. No, 1 hour session once a week is usually enough, and it just kind of depends on what's going on with the person. You know, we have people call and say, I've been thinking since I had kids, 15, 20 years ago, I never did anything about it. Okay, well, that's going to take some time to make changes in your body, so it's not just like come in a couple times and fix it. With any physical therapy program, it does take months, so we're going to need to really understand where you're at, and let's make a good plan. I usually do a 3-phase approach, so phase 1 is a lot of this lengthening stuff. We're moving joints, we're moving our body, we're trying to create space. Phase 2 is like we're starting to tap into that mind-body connection with our muscles. Are we connected to our abs? We start to have some glute strength. And then phase 3 is like getting back to what is important to you. So like we're doing running tasks, we're deadlifting, we're squatting, we're using barbell stuff, we're doing higher level things. So. That's all I have. Is there any other questions?
I have one.
Okay.
What could you tell a stubborn man?
Oh no.
It's normal to pee every 30 minutes.
I know. I have friends like that too, and they're like, we're at a concert and they're going every 30 minutes. And dude, stop doing that. Why? Like this certain friend has also got up on an airplane, like as we're about to touch down to go to the restroom. So it's definitely something we can help with in terms of behavioral strategies, but also pelvic floor lengthening. It's usually that tight pelvic floor that's not able to lengthen as that bladder is filling, and we're creating a kind of brain bladder connection where you're going to eliminate when your bladder's only a quarter full. Well, guess what? If you're always doing that, your brain's going to remember that when she's a quarter or he's a quarter full, I'm going to go let my pee out. And that's just going to become kind of an ingrained thing in your brain, and you have to retrain that, and also move your body and create length and strength too. So.